Hello everyone. My name is Maxwell. I'm from the University of KU Leuven in Belgium, and together with my two supervisors, Vero and Katrien, I'm here to talk about how to design and evaluate explanations in a predictive and transparent health dashboard. Now, to start off, I want to give you a little bit of context. So for a large-scale European project, we try to address the following problem, where about 60% of Belgian employees experience at least frequent or even chronic pain, and about 33% of those employees are on extended sick leave because of their pain. Now, additionally, a lot of these employees experience barriers when seeking help in terms of financial, location-wise and time-wise constraints. Now, a possible solution to overcome these barriers is an mHealth approach, where a digitized solution through a smartphone application could provide timely coaching and interventions. And so that is exactly what we set out to do by designing the Health and Power application that is tailored towards employees with chronic pain. Now, this app is able to offer interactive coaching through different informative modules covering various topics from pain education, informing users what pain is and how it originates, to topics such as activity management, stress, and social resilience. Additionally, the app also follows up on users through a Fitbit activity tracker, as well as a short daily questionnaires and more elaborate monthly questionnaires, inquiring about their mental state, pain, stress, and so on. Now, using this data, we are able to give users recommendations on how to better manage their chronic pain in the future. In a previous study, we also focused on explaining these recommendations in order to make the users understand why they are getting the health recommendations and to increase adherence. However, an app alone can only provide so much interventions, and that is why research calls for a so-called blended approach, in which digital solutions are extended with real human interventions or vice versa. So this means that aside from developing a patient-facing application that we just discussed, we should also develop a dashboard to enable health experts to follow up on their patients and potentially intervene when necessary. Now, what would these interventions look like? For example, if a particular user misses their coaching few consecutive days and the health expert knows that they could actually really benefit from this coaching, they could send an in-app reminder to nudge the user into picking up their coaching again. And if, for example, the daily questionnaire data reveals that their stress level has been increased for the past few days, they could send a reminder in the application to nudge them toward a mindfulness exercise within the stress module. But if there's something more severe going on, for example, their pain has increased for the past week, they could also suggest an in-person consultation when necessary. So these are various forms of interactions that could take place. But of course, in our app, we had about 300 users during our study, and in a real-life scenario, this user base could run into the thousands. And given the limited time that these health experts have, how can they easily detect which users have a high need for intervention and which ones don't? So for this, we implemented a prediction algorithm that is able to predict intervention needs based on the data collected from each user. In a previous study, using all this data that we have collected from the users within our app, we employed a clustering algorithm accompanied with manual labeling with 4 health expert users, which we can now use to detect patterns in user data and predict their need for an intervention. But how do we make sure that the health experts using our dashboard actually understand why the predictions are being made and that our decision-making process is transparent enough? Well, for that, we can turn towards the field of explainable AI, where explanations can be used to elucidate the prediction-making process. Given previous work of Wang et al., they suggested the use of feature importance explanations and counterfactual explanations are feasible for health experts in order to understand the system and the predictions that it's making. So we used this as a starting block for our study. Now here I want to give you a quick demo of what the initial designs of our dashboards look like. Starting off with an overview of all active users within our Health and Power application, as well as their logged questionnaire data. Now, as I previously mentioned, to aid health experts in identifying which users have a high need for intervention, we also include this predictive parameter in this overview. Additionally, health experts are able to identify how these predictions came about through explanations, starting off with the feature importance explanation, which shows which parameters are involved in the decision-making process and what their importances are. Now, design guidelines from previous work also state the importance of user control through explanations, enabling them to adapt incorrect classifications or change weights accordingly. We also implemented counterfactual explanations, which are able to give suggestions into how a parameter should change in order to decrease the urgency prediction. Now, we wanted to assess how useful these explanations are and how they should be adapted in order to be more useful for our health experts. So in the first iteration, we have a co-design session with 6 occupational therapists as well as 2 health researchers to assess the viability and usefulness of our counterfactual and feature importance designs. So during this co-design session, which took about an hour, all of the users were able to express how they would interact with such a system and how they would potentially improve the explanations in order to make them more viable. Now, this gave us some initial design takeaways that I'm briefly going to discuss. And the first takeaway is that there's a low need for control for our health coaches, at least in this task of overviewing all the patients and giving them interventions. Our users mentioned that they would rather focus on delving deeper into the data and their past questionnaire answers in order to give them more tailored interventions rather than spending time correcting the model, tailoring the model, and having control over the model. The second takeaway is that they would want to see the feature importance explanations simplified. So what suffices for a health expert is just to see the relative importance of each of the parameters. And the third takeaway is to introduce data previews. And that's because our health experts are really focused on tailoring the interventions that they want to give based on the data that they have seen from a certain patient during the week. And even though our explanations kind of aggregate this data, our expert users still want to see the raw overview of the data in order to make more informed decisions. So given these design takeaways, we are now able to improve our initial dashboard as well as the explanations that we had and test them through a focus group together with occupational therapists and physiotherapists. So the focus groups took about 1 hour per group, and we were able to get their preferences for the different explanations, as well as themes as to why they like or dislike certain explanations. So here's an overview of the participants that we had, which is a good mix of prevention advisors, as well as ergonomists and occupational psychotherapists. And here we also see the overview of the preference that they had, either being the feature importance explanation or the counterfactual explanation. And we also were able to extract some themes as to why certain explanations were preferred or disliked. But I also want to summarize the results that we just had in a few design takeaways that could be useful for future explanation designs. And the first one was that we saw a high need for data-centric explanations. So a lot of the users expressed their need to see potentially statistics, trends, or explanations regarding the data itself in order to make more tailored and informative interventions for the patients, rather than getting explanations about how the model works. This is something that aligns with previous work that also one of our colleagues has done, where they were looking into model-centric and data-centric explanations, and they saw a strong preference of health experts for these data-centric explanations. This kind of contradicts previous research, where models should be explained within a health context. However, in these health context, we do see a strong preference for data-centric explanations. But model-centric explanations can still be used in the development phase by both health experts as well as AI developers in order to improve the model and potentially catch parameters that should be added, should be adapted, as well as certain features and attributes of the model that should be adapted in order to be more performant. So model-centric explanations still have their place. However, we do see the tendency that they should be used in the development phase rather than the production phase. In the second iteration, we also saw again this low need for the exact feature attributions. When we are comparing the simplified versus the elaborate feature explanations, we saw that 6 out of 8 users still preferred the simpler feature attributions, which again highlights the low need to exactly understand the model. And then the third takeaway relates to the certain measurements that were included in the model, which our health experts noted that they should not be included in the model as they are very subjective, and it's very hard to make predictions and make decisions based off of these subjective measurements. So that is why health experts suggested that the objective measurements, such as the amount of steps taken, as well as the activities that they have logged, should be used to make predictions, and these subjective measurements can be then used as additional contextual information that they can then use to base their interventions off of, but should not directly be included in the model. So I quickly want to summarize our work that we have done, where we started off with initial designs based off of previous literature into how to design explanations, and then through 2 studies we were able to extract various themes as to how these explanations should be designed. So that is it for the presentation. I would like to thank you and feel free to reach out if you have any questions. Thank you so much.